Welcome to NP Certification Q&A, presented by Fitzgerald Health Education Associates. This podcast is for NP students studying to pass their NP certification exam. Getting to the correct test answers means breaking down the exam questions themselves. Expert Fitzgerald faculty clinicians share their knowledge and experience to help you dissect the anatomy of a test question so you can better understand how to arrive at the correct test answer. So, if you're ready, let's jump right in.
When evaluating the laboratory assessment of a patient with alcohol use disorder, the psychiatric mental health nurse practitioner may reasonably expect to find all of the following abnormalities due to chronic alcohol use, except. What's the exception? A, macrocytosis, B, transaminitis, C, uremia, or D, hypertriglyceridemia. So let's just take a moment to review what they are. Macrocytosis, remember, is an elevated MCV on the red blood cell differential. When we evaluate a red blood cell from a patient, we often begin by looking for anemia, whether or not the hemoglobin or hematocrit is low. And of course, that is one of the most important things that we get from the red blood cell differential. But then the next thing we look at is the mean cell volume, the MCV, and that tells us if the mean cell volume is within normal limits, if it's lower than average or higher than average. If the mean cell volume is lower than normal, if the volume is smaller than normal, we refer to this as a microcytosis, a small cell. If the red cell size is normal, then we view it as normocytosis, a normal cell size. And if it's large, we regard this as macrocytosis or macrocytic. The cell is large. So A really speaks to a large red blood cell. Transaminitis, choice B. Transaminitis speaks to elevated liver function enzymes, specifically the ALT and the AST. And the ALT and AST typically are our index of acute liver insult. You know, laboratory reference ranges vary, but generally these are, in the baseline healthy patient, somewhere between 0 and 40. Anywhere above 3 times the upper limits of normal, or rather 3 times 40, which is 120, we presume acute liver insult. There is some acute thing going on to insult the liver and cause acute inflammation. But sometimes the transaminases, the ALT and the AST, are mildly elevated, but not quite 3 times the upper limit of normal. And this we refer to more as a chronic or moderate elevation, a moderate chronic liver insult. Uremia is the retention of urate. This is elevated by an elevated BUN in the patient. And hypertriglyceridemia is one very specific fraction of the lipid panel, the triglycerides, which most often is related to ingested fat or ingested foods. So again, we're talking about the patient with alcohol use disorder. You may reasonably expect to find all of the following abnormalities except, and the exception, the thing that is not typically impacted by chronic alcohol use, is choice C, uremia. This is the correct answer. Chronic daily alcohol use may produce macrocytosis, transaminitis, and hypertriglyceridemia, but there is no known association between chronic alcohol use and uremia. So if your patient is a chronic user of alcohol and their BUN is elevated, they have 2 different problems here, the alcohol use and the uremia. If that's the case, you need to pursue the cause of the uremia and not attribute it to alcohol. Conversely, elevated red blood cell or mean cell volume, increased transaminase concentrations, or elevated triglycerides, all of these may be associated with increased alcohol volume. If you have a male patient drinking 5 or more drinks a day, a female patient drinking 3 or more drinks a day, it can produce any one or all of the laboratory abnormalities reflected in A, B, and D. Now, it's important to remember that they're not all specific to chronic alcohol use. They can all be caused by something entirely different. Macrocytosis may be a macrocytic anemia, might be a B12 deficiency or folic acid deficiency, or macrocytosis, for that matter, may actually indicate some other much more serious problems in the hematopoietic system. Transaminitis, liver insult, can occur for any variety of reasons. Chronic alcohol use is just one of them. Hepatitis is clearly another one. Drug toxicity is yet another one. So again, not specific to alcohol use. It's just one of the things we consider. The same thing with hypertriglyceridemia. When the lipid differential is fairly normal, but the triglycerides alone are elevated disproportionately, it could be due to many things, but chronic alcohol use is among them. So it's important to keep in mind that A, B, and D, while all of them may be associated with chronic alcohol use, it's just one differential. None of them are specific for it. But uremia really isn't related to alcohol use. In the patient with alcohol use disorder, if they are uremic, you as the clinician definitely need to pursue other etiologies there.
Thank you for listening to NP Certification Q&A, presented by Fitzgerald Health Education Associates. Please rate, review, and subscribe to this podcast. And for more NP resources, visit FHEA.com.